Okay, welcome. Today's Lunchbox talk is about the mental health crisis response services in Minnesota. If you are unfamiliar with NAMI Minnesota, we are the Minnesota chapter of the National Alliance on Mental Illness. Our mission is on the screen right now. It's one of the reasons why I work for NAMI Minnesota. But we use education, support, and advocacy to champion justice, dignity, and respect for all people and families affected by mental illnesses. One way we do that is through education classes like this. I want to introduce myself. My name is David Gale Manolis. I am NAMI Minnesota's Suicide Prevention Coordinator. I am available for any questions. One of the best ways to get a hold of me is through my email address. It's on the screen right there. And it is, if you just think of my title, Suicide Prevention Coordinator, it's just spc@namimn.org. My colleague Greta is also on the call today. She will be helping answer questions in the chat. Greta is the Director of Children's Programs at NAMI Minnesota, and she is also recovering from COVID right now, and so she may not be unmuting herself. And I don't know if you're not coughing right now, Greta, if you have anything else you want to say to introduce yourself.
No, I think I am the Director of Children's Programs, so I work with programs for youth, programs also for parents and caregivers, as well as professionals who work with youth as well. So all of those things. And I see that you have the long email address. It can also be shortened to docp@namimn.org if you ever want to reach out to me, and we can chat about what resources we have available.
Okay, well, thank you, Greta. Moving along, I want to just start the way I do all classes that have to do with suicide and suicide prevention, and that is to recognize that suicide can be a very difficult topic, and for many good reasons. It's pretty common in groups of people to have people that have been touched by suicide in some way at some point in their life. You may be a survivor grieving a suicide loss. You may have survived a suicide attempt, or you might be living with suicidal thoughts right now. But in any case, if any of the information that I share today brings up painful emotional memories, we at NAMI Minnesota really encourage you to take care of yourself and to seek support. One way to seek support is to stay on the call afterwards, and I will be able to talk with you no matter what, or you can send me an email and I will reach out to you afterwards. And don't forget about the 988 Lifeline. I'm going to be talking in quite a bit more detail about that later, but that is a way to get support anytime, day or the night, for any type of emotional distress. So just encourage you to take care of yourself. One favor is that if you do leave today's class because you need to take a phone call, please just send a quick note to Greta through the chat. Sometimes if people leave a class that has suicide prevention content in it without notification, we worry about your safety, and so we'll follow up just to check in with you just in case. The outline for today's class, I want to discuss when to reach out for help, and then two great resources in Minnesota. Someone to talk with, and that's through the 988 Lifeline, and then someone to respond face-to-face, and that's our county mobile crisis and response teams. I'm going to conclude with understanding the times when contacting 911 might be most beneficial. And that's just understanding what urgent, life-threatening emergencies might look like. So moving on, when is it okay to reach out for help? This first point is based on quite a bit of research that has been done in the last couple of years as the 988 Lifeline has expanded. and the American Advertising Council, in collaboration with numerous public health organizations, have done some research into this, and they've found that the word crisis in the title of many of these resources kind of makes people hesitate to reach out. They have trouble deciding if their situation is serious enough for a crisis call. And I want to encourage you to view these resources as places where you can get help before things reach a crisis stage. Okay. And just the general rule of thumb is it's okay to not be okay. And when you're not okay, it's okay to reach out for help. And I want to emphasize that both of the resources that I'm going to be sharing today aren't just for the individuals that are experiencing the emotional difficulties or the mental health crises. They also can support the people who are worried about them and don't know quite how to help. Okay, so the first the the first kind of place to go to when there's any type of mental health concern, emotional distress, is to call the 3-digit phone number 988. And as I've been presenting suicide prevention classes over the last couple of years, I'm finding more and more people have at least heard of 988. And I want to describe and take a moment to describe what it is. First off, it is an improved version of the National Suicide Prevention Lifeline. That was an old 1-800 number that was established in 2005. And over the 2 decades after it was established, the probably the first decade, they started to realize that people had trouble remembering that phone number. And so through some national legislation at the federal level, they created an easy to remember 3-digit number, and it was 988. And the Suicide Prevention Lifeline transitioned to 988 in July of 2022. Along with that was an expansion of the service. They added text capabilities and chat capabilities on the website. And they also expanded training for the crisis counselors. So in many ways, the system improved starting in 2022. There is also a veteran network, and I'll describe in a moment how to access that. But if the veterans or military personnel or their families are struggling, you can reach out directly to crisis counselors that have lived experience in the veteran or military community. We also have a nationwide Spanish subnetwork where you will talk to trained counselors that speak fluent Spanish. I want to emphasize that this service is 24/7 every day of the year. It's free, there's no charge, it is absolutely confidential, and you can get help from trained counselors. And what their main job is to help stabilize the current situation, provide a safety plan to keep people safe for now, and then to connect people to needed resources. When I think about the types of things that 988 can respond to, one of the things that I think is most helpful is to show a short little social media blurb that they created to advertise their service. And so I'm going to play this real quickly. There's no real words other than what's on the screen, but there's a little bit of music in the background. Okay, one thing that I want to emphasize, if you noticed throughout the words that were on the screen, that they use the words lifeline. And actually the 988 system, the official name is the Suicide and Crisis Lifeline. But they are transitioning to just using 988 Lifeline because when you look at the number of different things that they can help with, it's not just suicide and it's not just a crisis. They want people to know that you can reach out for any type of emotional distress, any type of need for support, and that they just don't want people to hesitate about wondering if their situation is severe enough. Okay. So I want to just describe real quickly kind of what to expect from 988. So if you call 988, you will hear a short recording, which will give you a couple of options. It will say to press 1 to connect with the veteran network, press 2 to connect with the Spanish network. And if you don't select any option, it will connect to your local call center. The way in which it does that, it's not based off your exact location on your telephone because the 988 network cannot get an exact location, but it gets a general location by what's called geo routing. It's based on the location of the cell phone tower that your mobile phone is connected to, or if you're calling from a landline, from the area code that the landline is coming from. So they prefer to route people to local call centers so that the crisis counselors know of local resources that they can connect you with to offer support. After you select one of those options, there's going to be a pause and you'll be transferred to a crisis center. The average wait time in the last year in Minnesota was about 20 seconds or less. So there really is not a very long wait time. You can ask for a language interpreter. They have I think access to interpreters for up to 250 different languages. When I talked with some 988 counselors a couple of months ago, they said that delay might take between 2 to 5 minutes to get the interpreter. When you text to 988, you'll be asked to answer some basic questions about your situation, and then you'll be transferred to a counselor. And in the same way with the chat, they do a brief survey, and then they can connect. There are American Sign Language trained counselors available 24/7. You can connect via video on your computer or phone at the 988lifeline.org website. There is also the option to use the other deaf and hard of hearing options by calling the 988 number. One thing that I want to just describe as some data about usage in the last year for 988, and this comes from 2024, and the data is just from Minnesota calls, and in that year 94% of calls were stabilized during the 988 call. So users that called, their issues were stabilized and safety plans were created and no further immediate interventions were needed. Approximately 4 to 5%, the counselor determined that the situation required more intensive interventions, and they handed off to mobile crisis response teams. There were only between 1 and 2% that were referred to 911 emergency response. The 988 counselors view that as an absolute last resort. They do not have personally identifiable information. So when they do that, most of the time they have the cooperation of the person in need. And it's very, very rare for there to be an involuntary referral to 911. And that's only if there is indication that there's imminent threat to life at the time. So because kind of that next level of care from 988 is the mobile crisis response teams, I want to take a few minutes to discuss what the mobile response teams are. These differ from 988 because they involve licensed mental health professionals. The crisis response teams are licensed professionals paired with highly trained practitioners that bring psychiatric services out into the community directly to individuals needing care. I need to clarify that in Minnesota, 4 of our tribal communities have their own mobile crisis response teams, and every one of our 87 counties have mobile crisis response teams. There's a couple different ways to connect with a mobile crisis response team. 988 counselors can do a warm handoff if needed to a mobile crisis response team, and 911 dispatchers also can connect with a crisis response team. However, those two systems, though the system is supposed to work smoothly, it has not gotten to the point where it is 100% reliable to connect with the mobile crisis team. So for the time being, it's wise to call them directly if you need the services of a mobile crisis response team. You can find your local team's phone number at a website called justcallmn.com. And we recommend that you find your local crisis response team number and program that into your phone. And if you have loved ones that live in a different county, find their crisis response team also and program that phone number into your phone so you always have it. So the types of situations that the mobile crisis teams can help are when you or someone you care about are experiencing things just like feeling lost, overwhelmed, and hopeless. If you're experiencing depression, anxiety, or a panic attack. Of course, having suicidal thoughts are something that they are trained to help stabilize. If you're experiencing that you're wanting to harm yourself or harm other people, they can help with that. If you're experiencing rapid mood swings, they can help. Sometimes if people start to fear that they're losing touch with reality, because they offer psychiatric services, they can help with that. If you're at risk of being unable to care for yourself, or you're having difficulty functioning in a healthy manner as it's connected to your emotional or mental health, those are types of situations that crisis response teams can help. It's important to understand the purpose of the teams and what their goals when they make appointment or a visit with somebody in need. Their first goal is to de-escalate the mental health crisis, to stabilize things for the time being. As part of this visit, they also do a thorough assessment of the individual's needs and their situation, and they can develop highly individualized safety plans and also action plans for getting future care. And as part of those safety plans, they will help the individual in need learn some coping skills for immediate stressors. They can connect to local ongoing mental health care, because you remember they are practitioners, they are licensed professionals from the local community, and they know the resources that can help. Another piece of it is that they can identify and connect resources to support independent living. Just last week, I led a training with a team of mobile crisis responders from the Owatonna area, and a number of them were describing how they sometimes will even drive a person in need, a client, to a food shelf. They may connect people with social services organizations to address some of those social determinants of health that can impact mental health. But again, because they are from local communities, um, they can connect with the social workers and the resources to help those situations. Um, the overall goal, though, is to avoid unnecessary law enforcement responses or involuntary transportation and hospitalizations. And they're very effective at doing that. Very few people that have a crisis response visit to their location will end up being transported to a hospital. That the goal is to avoid that if at all possible. So I want you to think of a mobile crisis team response as a mobile medical appointment. It works by when you contact the call center, whether it's a warm handoff from 988 or you call directly. Um, they have a call center where a trained responder will answer the call, collect information about the situation, and then will dispatch the response team. Um, the response team is usually made up of two, sometimes three people. It isn't always the mental health licensed professional that goes, though oftentimes it is. But the highly trained practitioners are more often the ones that are sent to the individual's location. I want to make it clear that response times vary. When I've talked to the Metro County mobile crisis teams, their goal is to reach the person in 40 minutes or less, and that's about the average time. Sometimes it takes a little more, sometimes it takes less. In our rural counties, the response time may be longer, and especially because some of the northern counties that are very large, they also band together to offer services. So sometimes it can take a long time. There's some creative ways that the mobile response teams have begun to use to address that long wait time problem. I know that in the southwest corner of the state, that Rock County and some of the counties in the far southwest have developed a partnership with public safety organizations, the sheriff departments or the police departments, where the officers carry uh, um, tablet computers, where the officers will deliver the tablet computer to the person in need and then kind of step outside that this isn't there. And the crisis response team can begin the intervention while they are en route. So there's one person driving, the person riding along will begin the intervention so that the wait time isn't as long. Another advantage to this being a medical appointment is that all details about the visit are confidential and they're protected by HIPAA laws. Um, that is something that's different when law enforcement responds. Even some sheriff departments or police departments have gotten grants and they've partnered with social workers and hired social workers to respond along with law enforcement. Um, those visits are treated like a law enforcement visit, and so they aren't protected by HIPAA laws. Um, the mobile crisis response teams are protected by HIPAA laws, and I think some people are comforted by that. Another fact that you need to know about these is that the crisis response teams can bill insurance, health insurance, because these are considered to be medical appointments. However, a law that was just passed this last session in the Minnesota State Legislature has required that the crisis response teams provide care no matter the patient's ability to pay. So they're not going to charge copays, deductibles. They will serve people if they don't have medical insurance. And there's a little bit of a kind of a law interpretation problem. And some people interpret this that people cannot be charged copays and deductibles at all. And some people say that maybe the insurance company would require a copay to be paid, but the county can't charge it. So I think that I've heard both of them, but the overall rule is that that you can't be denied service for an inability to pay. I want to conclude with kind of some clarification when 911 calls might be needed. Years ago, I was a longtime teacher, but I remember that in the late 90s, we were taught that pretty much any time people say the word suicide or that they're having thoughts of suicide, that 911 needs to be called. And what we've really found that, especially now that there are so many other resources like 988 or the mobile crisis teams, that 988 or 911 should only be used for urgent life-threatening emergencies. So 911 is usually called for things like a crime in progress, a fire, a accident, a heart attack, things that are urgent, life-threatening, you need help right now. In the mental health realm, just saying that you have thoughts of suicide isn't immediately life-threatening. There are other interventions that can happen to keep a person safe than calling 911. However, some situations in the mental health realm that might be life-threatening are if a suicide attempt has already occurred. So if somebody may have begun an overdose, they may have lost consciousness. If you suspect something like that has happened, that's a life-threatening emergency. There are some times where people experience something called a command hallucination, where they have voices telling them that they have to end their life. Those can be triggered by lots of different situations, a psychotic episode or like a cannabis-induced psychosis, sometimes some illicit drug use, sometimes trauma memories. All of those types of things can maybe trigger those kind of command hallucinations. But in that situation, verbally talking to somebody isn't going to help, and that's a life-threatening emergency. If the person is just physically out of control and they're not responding to words, they're not responding to any effort to kind of connect and calm the situation, and their behavior is endangering their own or another person's life. So they're holding a weapon and threatening to use it against themselves or other people. That's a situation that the mobile crisis teams aren't trained to help with. 988 over the phone is not likely to be able to help, and law enforcement who is trained to do that can help. I know that in the news, we somewhat frequently hear horror stories of officer-involved shootings that involve a mental health call, and that is something that occasionally happens, and I need to acknowledge that. However, that's also a situation where the bad news or the bad situations are talked about and visible, where the thousands of interactions from law enforcement with mental health emergencies aren't really seen. And so, you know, it's far more common for the law enforcement intervention to be effective. I also want to say that there's sometimes people's state is such extreme danger that their suicide attempt might be extremely imminent, and like even if you think you might want to transport them to a hospital, but you can't do that safely, that may be a time when a 911 call would be appropriate. Okay. If you do call 911, it's important to remain calm when you're talking to the dispatcher. Clearly communicate that you are talking about a mental health emergency. Be prepared to give as much information as possible, including things like the person's diagnosis, if you know it, any medications the person might be taking, details about the current episode, when it started, what the trigger might have been, and if you know what has worked before, what tends to calm the person down, what tends to uh, make the person more anxious and more emotionally distraught. And it's okay to ask for officers that are trained in mental health first aid, or there's a 40-hour training that more and more offices are using called CIT training, the Crisis Intervention Team training, and they are more skilled in de-escalating mental health emergencies. And so that was a quick half an hour overview of the three options, 988, the mobile crisis teams, and the 911. And with that, I'm going to open it up for questions and discussion. I think we have about 17 people, so maybe if you have a question or comment, you can put it in the chat. And Greta, if you can just monitor the chat for a moment, I'm going to put a handout that explains a lot of these options in the chat, and we'll also email it to all the attendees at the end of the class. Are there any questions, comments, things you would like to know more of? Thank you, Stephanie. I appreciate you attending. I think sometimes there might be some kind of gray area of when it might be appropriate to use different resources. We can certainly talk through some of those options. Have a good day, Bobby. Have a good day, Danielle. And thank you. Yes, I can go back to the previous slide. Thank you, Tammy. So Elizabeth, that is a good question. I probably should have included that description. If you are unaware that prior to this July, the 988 system had a third option available, where you could connect to a subnetwork where the crisis counselors were from the LGBTQ LGBTQ plus community, and they provided focused support for LGBTQ plus individuals. In July, the current administration removed that service from 988, and there's a couple reassuring things. First off, the Minnesota crisis counselors have been provided focused training for sensitive support for people from the LGBTQ plus community. They're trained to be culturally responsive in lots of different ways to have understanding support. There still is focused support available through the Trevor Project. The phone number for the Trevor Project is on the handout that I had earlier. And so, though it's not quite as easy as it was a few months ago to get support in that community, it is still available. And hopefully, Elizabeth, that clarifies it a little bit. So again, the general 988 counselors can provide support, but the Trevor Project does have focused support still. Okay, any other questions or concerns? I know a few of my colleagues are on the call, and Tracy is one of our helpline advocates. I don't know if you have questions that have come up as you have talked with people, and anything that we can discuss. Okay. I'm going to stop the recording right now. And again, if people now